after my ingrown toenail surgery, and as you can see, it relieves all the pain. I feel no pain doing this now. And now I'm going to show you what was in there. When I had it done, the doctor came in and cut out all that right there. And that little point is what was causing me all that pain.
Not feel anything, and the edges here that are pretty ingrown are on the edge of being infected, but they're not the normal infected toenail that we see in the office. But we're going to remove both borders, this border and this border. Okay, here's the toe with the tourniquet around the base, and here's the tool that I'm going to use to give her a new nail edge. You can see how deeply ingrown it is way down the edge here. I'm basically just going to scoot across the area here and go back along the edge. There's one corner. And then we're going to go across this corner here too next. Okay. Blot the excess blood. And then these corners come right out. Here's one corner first. There we go. No more toenail. And the nice part is I'm taking out all that callus, and that won't come back either. And she'll never have to remove that at the pedicurist again. And then this edge will close up just like that. Now we're going to remove the other edge. Voila. Both edges are gone. Now we're going to put the chemical in the corners, and I go right underneath the nail edge here and here, blot off the extra, and now I'm putting the chemical in both corners so the nail in the middle will grow and the edges will not. There. And now the nail edge roots are gone, and we'll go ahead and wrap her up, and she'll come back to the office in a week. And there's virtually no pain after this procedure or stitches.
Hi, I'm Dr. Leo Krawitz of Healthy Feet Podiatry. Today we're going to do a nail procedure where I remove the side of an ingrown nail that's infected on one of my patients. So this is the toenail that's infected. It's this side of the nail right here, and I'm sure there was probably pus coming from the nail earlier. You can see the dry drainage on the side of the nail here. This is usually very painful for the patients, and it needs to be removed permanently so the nail will never grow back on the side. So what I'm going to do first is numb up the toe, and this is a local anesthetic of 1% lidocaine. And we're going to numb the toe up here. We just put a little on each side here. As you can see, it's relatively painless. The toe gets numb pretty fast with this injection, so now I'm going to be able to put a tourniquet around the toe. And this actually pushes some of the blood out of the toe, as well as acts as a tourniquet. So there'll be minimal bleeding, although there will be some bleeding during the procedure. Now we'll open up this tourniquet so we can see the side of the nail that's affected. And what I do first is free up the side of the nail that's infected, and I'm going to take a few millimeters here. We'll go under the nail plate itself, free it up all the way down in the corner, and as you can see, this goes way down into the corner. And some of the nail is already loose on the side just because of the infection. The infection will actually lift up the side of the nail. So now I'm going to cut the side of the nail that's ingrown. As you can see, it's already flaking apart from trauma to the nail previously. Then I'll take my hemostat and go all the way in the corner and slowly pull the affected piece of the nail out. And you can see how far down that's going. You see all that is all nail digging into the skin. And that's all part of the ingrown nail. On the side of the toe, after the nail is ingrown for so long, you get what's called granulation tissue. And this is this proud flesh right here on the side. Eventually that will go down, and the swelling will go down on the side of the toe as well. Now I'm going to make sure that the side of the nail is dry.